Before we begin, we have to follow certain COVID-19 protocols such as wearing a mask and then applying alcohol to our hands. So when that's done, we can now begin with our assessment. So, hi sir, good morning. My name is Ethan Benaventura and I'll be your physical therapist for today. So how are you, sir? Sir, that's good to hear. Before we begin, sir, may I know your name and your date of birth for verification purposes, sir? Thank you for that, sir. So today, sir, we'll be doing a range of motion test and as well as a manual muscle test, sir. For the range of motion, sir, it will help us, it will help us assess if there's any limitation motion of your joint, sir. And for the manual muscle test, sir, it will help us assess if the strength and the integrity of your muscles, sir. Okay, sir, so at the later part of this assessment, sir, it will require me to come into contact with you. Would that be okay? Okay, so before we begin, sir, I have to take your vital signs, sir, to assess if you are fit to do these kind of tests, sir. So will that be okay, sir? Okay, thank you for that. So first, I will be taking your blood pressure, sir. So we'll be using this sphygmomanometer as well as this stethoscope. We'll be taking your pulse rate, your respiratory rate, and as well as your temperature, sir, using the thermometer. Assuming that all of these are within normal conditions, we can now begin with our assessment. So first, sir, we'll be taking the range of motion test, sir. So this is the goniometer, sir. This is the tool that we'll be using to assess for the range of motion, sir, of your kanang left ankle na dorsiflexion, sir. I know the left ankle dorsiflexion is just a big word, sir, but what it means, sir, is just we will test the range of motion of your toes pointing upward lang, sir, ha? Okay, sir, so sir, part 2, sir, this is the fulcrum, sir, which will be the basis to where we will put the goniometer, sir. This is the moving arm, sir, this one, and this is the distal arm, sir. So, sir, at this time of the assessment, sir, to requires to change positions. Would that be okay, sir? Okay, sir. So what I want you to do, sir, is sit down on a stable lang, sir, ha? Okay, sir. And I want you to kanang let your lower legs hang lang off the table, sir. Okay. So, sir, for the fulcrum, for the proctor lang, okay, the fulcrum is placed on the lateral aspect of the lateral malleolus. We'll be palpating for the fibular head, and then we'll be placing the fulcrum there. For the proximal arm, we'll be placing it on the lateral midline of the fibula. And for the distal arm, we'll be placing it on the lateral aspect side of the fifth metatarsal. So, sir, at the count of 3, sir, I want you, sir, to point your toes upwards, sir, ha? So, 1, 2, 3. Okay, sir. Okay, sir. So, balik lang. Stay lang sa na position, sir, ha? Because this will be, I'll be doing, sir, our next assessment, sir. So, this is your manual muscle testing, sir. So, sir, there are 5 readings of this, sir. So, grade 5, sir, meaning that you'll be putting maximum resistance, sir, while doing the full range of motion, full motion of your kanang foot, sir. For 4, sir, will be moderate resistance, sir, while doing the assessment, sir. 3, no resistance, sir. And then 2 is that we will be testing if you can move your muscles, sir, with my support, sir. And 1 will be testing if you're moving your there's no movement, but you can contract your muscles lang, sir. So for this assessment, sir, we'll be testing for your knee extension, sir, or the straightening of your knee, sir. So I'll be applying lang, sir, ha. There's a towel lang under here lang, sir, to your right knee lang, sir. Okay, sir. So first, sir, I will be testing for no resistance lang, sir, to see if you can straighten your your knee, sir, ha? Okay, sir, so at the count of 3, sir, sir, before we begin this, sir, I want you to place your your hands on the side lang, sir, of the table, sir, for support, sir, and then lean back a little lang, sir, ha? Okay, para dili kayo tight imong hamstring muscle, sir. Okay, sir, so, sige, sir, at the count of 3, sir, what I want you to do, sir, is straighten your legs, sir, ha? Sige, sir, 1, 2, 3. Okay, sir, so next, sir, okay, since you did it, sir, we will be testing for the grade 5 and grade 4, sir, ha? So, I'll be applying a maximum resistance, sir, when you raise your legs, sir. Sige, sir. At the count of 3, sir, I want you to raise your legs, sir, ha? Sige, 1, 2, 3. Okay, sir. So, wala naman mo nabuhat ang grade 5, sir. So, let's try to move to grade 4 lang, sir. Okay, sir. So, okay, sir. At the count of 3, sir, I want you to raise your legs, sir, ha? Sige, 1, 2, 3. Okay, sir. So, ano naman buhat, sir? That's okay, sir. So, let's go back to our original position, sir, ha? Okay, sir. So, for your range of motion na test, sir, of your left ankle dorsiflexion or the raising of your toes towards the ceiling, sir, I have seen it, sir, na 0 to 20 degrees ang imong range of motion, sir. So, which indicates that that's a good test, sir. So, full range of motion, there's no limitation of motion na, sir. So, next, sir, for your manual muscle testing, sir, I gave it a grade of 3, sir. So, what does that mean, sir, is that for the grade 3, sir, you can move, sir, your legs, sir, but without resistance. So, we tested for 5 and 4, sir, na you can't you cannot move your foot, sir, if there's a resistance applied. So, we'll be addressing that in our plan of care later on lang, sir, of the assessment, sir. So, before we end the assessment, sir, and now we have to take your vital signs again. Would that be okay, sir? Okay. So, assuming that all of these are within normal conditions, so, sir, so thank you for coming to our rehabilitation center, sir, and I hope to see you in our next session, sir. So, stay safe and God bless always, sir. Take care and goodbye, sir. So, we have to clean the work area na, sad. Take care of the instruments that were used. And now we can end with our session.